Hello. Thank you for joining me to learn more about our weight loss surgery program at Milford Regional Medical Center. I'm Phil Cohen, the medical director of the program, and one of the bariatric surgeons that is part of the team who can lead you through this life-changing transformation. We call our program Fresh Start because we believe the positive impact our weight loss surgery program can have on your health and well-being gives you a fresh start in life. All of our bariatric surgeons at Milford Regional Medical Center have specific training in bariatric surgery, and our center is accredited by the American College of Surgeons as a comprehensive bariatric center. In order to understand how we talk about obesity, you need to understand some of the terms. We talk about body mass index, which is a calculation between your height and your weight. There are plenty of internet-based calculators available that can calculate your BMI for you. If your BMI is over 40, you qualify for surgery. If your BMI is between 35 and 40 and you have comorbidities such as diabetes, hypertension, or obstructive sleep apnea, you also qualify for surgery. Another term you should understand is excess body weight loss. If you have 100 pounds of excess body weight and you were to lose 50 pounds, then you have a 50% excess body weight loss. This is how we gauge the success of surgery. Your options for weight loss, as you well know, are diet with exercise, and other commercial weight loss programs. In 1991, the National Institute of Health endorsed weight loss surgery as the best long-term solution to combat morbid obesity. When speaking about the medical indications for surgery, you've already learned that if your body mass index is over 40, or if your body mass index is over 35 and you have a comorbidity, you qualify for surgery. The most important thing about weight loss surgery is making sure that you have the willingness for long-term follow-up. Additionally, you should be medically stable to undergo surgery, and we will make sure of that as you come through our program. Also, long-term follow-up is extremely important, as we want to make sure that you are successful with your surgery. As you can see here, a multitude of medical problems do improve after bariatric surgery. While you can see that there are many benefits of having surgery, as you have probably heard from your physician, there are many risks to not losing weight. So let's talk about some of the goals and benefits of weight loss surgery. Obviously, weight loss is one of our goals, but our biggest goal is improving your health. Many of our weight loss surgery patients have successfully lost weight and are now leading healthy and active lives. I'd like you to meet some of them. Meet Ed. Ed had a laparoscopic vertical sleeve gastrectomy. He was 385 pounds and is now an energetic 186 pounds. His medical problems are now a thing of the past. Michelle also had a laparoscopic vertical sleeve gastrectomy. She lost 105 pounds and now feels great. She no longer has diabetes, asthma, or high cholesterol. James had a robotic-assisted vertical sleeve gastrectomy. He started at over 435 pounds and has now lost about 200. He is no longer on medications for high blood pressure and high cholesterol. He hates exercising in a gym, so instead, he goes on 25-mile bike rides. Kelly had a laparoscopic vertical sleeve gastrectomy also. She has lost about 120 pounds and recently completed her 6th 5K race, which she never thought that she could do. She no longer suffers from asthma, high cholesterol, high blood pressure, or high blood sugar levels. A lot of patients want to know how to succeed with bariatric surgery. Here at the Fresh Start program, we employ a team approach where you are the most important member of that team. All of our patients will work with a nutritionist as well as have a behavioral health assessment. As I mentioned before, Milford Regional Medical Center is a comprehensive bariatric surgery center. Patients over the age of 65 or with a body mass index over 65 may require special consideration. Now, I'd like to introduce Dr. Donald Cherniak, one of my partners and another bariatric surgeon at Milford Regional.
Thank you, Dr. Cohen. As Director of Minimally Invasive Surgery at UMass Memorial Medical Center, I am very proud of the bariatric surgery program that we developed here with our partner, Milford Regional Medical Center, in 2013. There have been hundreds of patients who have benefited from this program at Milford Regional and are now leading healthy, active lives. I'd like to go over the weight loss surgical options available to you at Milford Regional. In today's bariatric surgery landscape, there are two primary operations that are available. Both of these options are available at Milford Regional Medical Center. On the left side of your screen, you'll note the gastric bypass. This operation is considered a cornerstone of bariatric surgery and has been available for over 50 years. On the right side of your screen, you'll note a depiction of the sleeve gastrectomy. This is a more recent evolution in bariatric surgery and is also very effective for most patients. Both of these operations involve stapling of the stomach, and in the case of the Roux-en-Y gastric bypass, there is also an intestinal component. The first operation I'm going to describe is known as the gastric bypass. Again, this operation has been available for over 50 years. The operation is known as a hybrid procedure. That indicates that there is both a restrictive component to this operation as well as what we call a malabsorptive component. The amount of food that you can eat is restricted by the size of the gastric pouch, which is noted in the upper portion of the photo. The restrictive component is introduced by the intestinal portion of the operation, which is indicated in the lower portion of the image. Most patients undergoing gastric bypass surgery typically lose their weight in a period of 1 to 2 years after surgery. And then most patients successfully maintain a healthy weight thereafter. Successful patients can lose up to 70% of their excess body weight. This number indicates the amount of weight between your current body weight and what is considered to be your ideal body weight. The operation is offered to all patients with morbid obesity, but in particular, it may be more effective in patients who are sweet eaters, patients who have severe diabetes, or patients who are in the extreme weight category. I will now be discussing the vertical sleeve gastrectomy. This operation is newer and has been introduced in the past 10 years or so. It is also considered a hybrid operation in that it restricts the amount of food a patient can eat, but it also has a metabolic component that allows for more weight loss than would be estimated based on the patient's intake. Approximately 70% of the stomach to as much as 80% of the stomach is removed during this operation and discarded. Patients who undergo vertical sleeve gastrectomy can also enjoy weight loss during the first 1 to 2 years of up to 70% of their excess weight, very similar to gastric bypass. This operation is also considered a hybrid procedure in that the size of the stomach is restricted, but there is also a metabolic component that allows patients to perhaps lose more weight than can be estimated by their daily intake. The operation has also been shown to reduce hunger hormones that may be responsible for some eating habits. Due to recent advances in surgery, including the use of laparoscopy and the use of robotics, patients often only have to spend 1 night in the hospital. Our experience at Milford Regional is that 90% or so of patients are able to go home the day following surgery. Due to the use of our advanced surgical techniques here at Milford Regional Medical Center, we are often able to have patients get back to work within 3 to 4 weeks after surgery. For patients who have a more manually demanding job, we may ask you to stay out of work up to 6 weeks. I want to make it clear that the recovery from surgery, although physically demanding, is not the primary reason we keep people out of work. The time out of work is more related to the transition back to a regular diet after your weight loss operation. As pregnancy can complicate your weight loss efforts, we recommend delaying pregnancy until after surgery. It is usually safe to conceive 18 months to 2 years after bariatric surgery. I want to stress that this should be discussed with your surgeon prior to beginning efforts at conception. One of the effects of bariatric surgery and weight loss can be an increase in your fertility. We recommend at least one form of reliable birth control after the operation, if not 2. Patients often notice changes in GI function and possibly bowel function after bariatric surgery. Here is a list of common complaints from patients after the operation. I just want to highlight a few of these, which you may not be familiar with. The first item on the list is dumping. This is commonly called dumping syndrome. This is a constellation of symptoms that some patients develop after weight loss surgery, in particular after gastric bypass. The syndrome is characterized by a constellation of symptoms, including extreme fatigue, crampy abdominal pain, changes in bowel habits which can include diarrhea, and sometimes hypoglycemia. The syndrome is brought on by eating sugar in concentrated form. The symptoms can be avoided by limiting the amount of sugar in your diet. Another item on this list is vitamin and mineral deficiency. This is relatively uncommon after bariatric surgery, assuming that you follow our directions for vitamin intake and supplementation. Vitamin and mineral deficiency is a bit more common with gastric bypass, but can also affect patients with sleeve gastrectomy. There are certain things you can do to start on the path to a healthy lifestyle and prepare yourself for surgery. A list of these appears on this slide. I think some of the more important things you can do is try to get out and be more active on a daily basis. For some patients with limitations, this may be limited to a short walk. For other patients, it may be joining a gym or doing some other activity such as hiking that you enjoy. I also recommend getting diabetes under control if that is one of your underlying medical conditions. We like to see good diabetes control before surgery in order to help us avoid complications afterwards. I recommend taking a close look at your diet and trying to eliminate fried foods as well as high-calorie, non-nutritive liquids such as soda. Patients are also asked to abstain from alcohol and to involve their family in mealtime decisions. In preparation for surgery and as part of a healthy lifestyle, we recommend that all current smokers enter a smoking cessation program and quit smoking at least 4 to 6 weeks prior to the operation. We also recommend that patients stop using nonsteroidal anti-inflammatory medications such as Motrin, ibuprofen, Advil, and other medicines 2 weeks prior to surgery. Also, patients who are on stronger pain medications such as opioids or narcotics should wean down to the least effective dose that they can prior to surgery. We also ask patients to try and lose weight prior to surgery. The benefits of preoperative weight loss are it can make you more successful after surgery in maintaining a healthy weight. In addition, it may actually make your surgery a bit safer, as early weight loss can lead to reduction in organ volume, including shrinking the liver. We're also finding that some insurance companies are denying patients who do not lose weight after entering our program. You can avoid this by, again, adopting a healthy lifestyle and becoming more active, in addition to following our recommendations. This should lead to preoperative weight loss and help you avoid insurance denials. As a weight loss surgery patient at Milford Regional Medical Center, I can assure you that you will be well cared for. We have a physician available to answer your calls 24 hours a day, 7 days a week. Most of the time, these calls will be answered by myself or Dr. Cohen. Occasionally, when we are away or on vacation, expert bariatric surgeons from UMass will answer your phone calls. We have a very regimented appointment schedule after your surgery. This begins with a 2-week visit following the operation, followed by a 6-week visit, a 6-month visit, and then relatively frequent visits thereafter. Your follow-up appointment schedule will include frequent visits with your surgeon, as well as our nutritionists, in order to make sure that you are both safe and successful after your operation. I'd like to personally thank you for your interest in our weight loss surgery program here at Milford Regional. I hope the presentation helped you better understand how this program can improve your health and well-being. Following this presentation, please take some time to review the list of frequently asked questions and answers we have compiled. They were developed from our experience with patients that have attended our information sessions over the years. You will also learn about next steps to take if you would like to register for our weight loss surgery program. We look forward to assisting you on your journey to better health through weight loss.